my name is Britta. I'm a student nurse, and I'm here to place the Foley catheter that your doctor has ordered because you've been having a hard time using the restroom. Can you please verify the name and date of birth that on your wristband is correct? Perfect. Do you have any allergies? No? Alright, do you have any pain right now? No pain? Okay, that's great. So, what we are going to do today is insert the Foley catheter. Have you had one of those before? No? Okay, so what we do is insert the catheter through the penis after we've cleaned it. We're going to clean it with soap and iodine. So we're going to insert it through the penis into the urethra and into the bladder, where we're going to inflate a small balloon. And we're going to leave it there just for a few days until the urinary obstruction subsides. It shouldn't be painful. It might be a little bit uncomfortable during the procedure, but we'll work through that. Let's see. Do you have? You're going to be able to still move and walk around as usual. Do you have any questions? Okay, let me know if you think of anything. And then at any point during this procedure, if you are in pain, please let me know. Okay. I'm going to just make sure that I have everything here that I'm going to need. I brought the Foley kit in. I brought stabilizer tape. This is going to be my sterile syringe. I got a chuck to place under the patient, and then I have a a basin with soap and water, and then 2 washcloths, 1 dry and 1 wet. Alright, so now I'm just going to wash my hands and put on some clean gloves, and I'm going to wipe off the table here. I'm going to get every inch of it and the edges. I'm going to throw this away and grab a new wipe and do it once more. And in between these sessions, I'm letting it dry for 2 minutes. Okay, throw this away, let it dry for 2 minutes. I'm going to take off my gloves, wash my hands, and then I'm going to place the items on the bedside table. Alright, Mr. Elephant, so we're just going to get you prepped now. I'm going to close the door, and then I'm going to begin to pull up the blanket so that we can position you how we need to, okay? Just going to ask you to pull out your legs like this a little bit. Thank you. In the frog position. And then I'm going to lean you back so you're flat. Alright, are you comfortable? Okay. Here we go. Alright, you're going to be able to sit like that for a couple minutes, maybe 10 minutes or so? Okay, there we go. So next I'm just going to take off my gloves, wash my hands again, put some clean gloves on, and then I'm going to start cleaning the area. We're going to start with the warm soap and water, okay? I'm going to lift up the penis, and if my patient was not circumcised, I would need to retract the foreskin, but he is, so I'm just going to start by cleaning the meatus and going outward. Get a new part of the cloth, do it again, and then I'll also do the shaft from the head down. Alright, you doing okay so far, Mr. Elephant? Good to hear. Next I'm just going to pat it dry. Alright, we're all set. I'm going to place this out of the way, take off my gloves, wash my hands again, and then I'm going to start putting together my Foley kit. If you don't mind just giving me a couple minutes, Mr. Elephant, we'll be ready to go, okay? Just need to get everything set up. Throw that away. Okay, now I'm going to start opening the Foley kit. I'm going to go away from me first to keep the contents sterile. And I'm only touching the outer 1-inch border along the packaging. Okay, and now I would drop in the sterile syringe into the sterile field, like that. I'm just going to set this aside for now, pretend that it's already been dropped in there. And then next I'm going to open up the drape, only touching the outer 1-inch border again. And set it loose side down onto the patient. Do the same thing with the fenestrated drape once more, only touching the 1-inch border, and then I'm going to place it on top of the penis like that. Okay? So next I'm ready to put on my sterile gloves. I'm just going to move this over here so we have the most space. Let me wash my hands again. And I'm going to take these out. Just being careful not to reach over the white sterile field that's on my left as I put these on. Okay, so I'm all set. I'm just going to move over here and start setting up the kit. Staying within the 1-inch margin. I'm going to also place the lid on here and set it aside for now. Okay, then I'm going to open up the syringe and attach it to the balloon port. Okay, and then I can start taking off the catheter sheath. Alright, thanks for waiting on me, Mr. Elephant. We'll be with you in just a couple minutes, okay? Discard that. And place this there for now. Now I'm going to open up the syringe of lubricant, remove the plunger, and I'm going to place it in there about 2 inches deep. Okay, we can set that aside for now, and then finally I'm just going to open up the iodine, pour it all over the cotton balls, make sure to get all of it, discard that, and we're ready to move over to the patient. Okay, Mr. Elephant, we're going to start cleaning once more. This time it's going to be with the iodine solution. It might be a little bit chillier. Okay, so with my non-dominant hand, I'm going to pick up the penis. If he was not circumcised, once again, I would need to retract the foreskin and keep it retracted for the whole length of the procedure now. But we're going to just start cleaning now because he is circumcised. We're going to do one swipe around from the inside out. One swipe around from the inside out. Throw that away. And then one more dab on the very top. Okay, so it's all clean now. Next, okay, Mr. Elephant, we're going to start by inserting the catheter now, okay? Can you take a deep breath in for me, please? And slowly exhale. Alright, good. You're doing a good job. Alright, so I have urine flowing back at me. I'm going to advance it about 2 more inches. Alright, and then I'm going to stabilize it with my sterile hand. And then release the penis with my non-dominant hand. Now, if I had gotten resistance first while I was inserting it, I could take a short break because it's a normal thing for the sphincter to spasm. If there was still resistance, I would need to stop and call the provider. But it all went in smoothly, so I'm just going to use my clean hand to insert the 10 mLs of water into the balloon. Gently tug back on the balloon. Okay, it's in place. And then I can take off the syringe. Alright, so it's all in there now. Now I'm going to take off my gloves. How was that, Mr. Elephant? Are you still doing okay? Alright, that was the hard part, so you did really good. I'm going to wash my hands, put on some clean gloves, and then we are going to collect some urine. I'm going to just open this up, get it ready to go, not touching the sides, or the insides, excuse me. And then I'm going to clamp the tubing here. And then I would scrub the hub soak it with a chlorhexidine wipe for 5 seconds and then let it air dry for 5 seconds. And then I can insert the syringe that I had already dropped into the sterile field and take out between 5 and 10 milliliters of urine. Okay. Take that off, being careful not to touch the tip of the syringe, and I can carefully place it in the specimen container and replace the lid. Now I'm going to label this with the patient's name, MRN, and the date and time of collection, and I can send that to the lab. I'm just going to set this aside for now. Alright, let me change my gloves once more just because I was handling the urine. Washing my hands, putting on clean gloves, and we are ready to unkink this now, and then I'm going to stabilize the device. So let me just grab some tape. We're going to put this up here near the patient's groin or upper thigh. Alright, now we're going to take this out and hang this at the bedside. Mr. Elephant, while you have this Foley catheter in, we do need to make sure that it always stays below your waist or your bladder. Even though if you're in bed, it needs to stay down here on the railing. And or if you're walking around with the Foley cath in, just make sure that's always below your bladder so that urine does not flow back in. Okay? Alright, so that's all. I'm just going to start cleaning up. Alright, Mr. Elephant, you did a really good job. How was it? Could you tolerate it? Oops. Alright, the patient says yes. It was pretty good. Are you in any pain right now? No? Okay, that's good to hear. Do you have any questions or concerns about the procedure? No? Okay. Well, let me just get cleaned up and I will get out of your hair. Alright, all of this would go into the trash. I'm going to take off my gloves, wash my hands, and then I'm going to reposition the patient. Alright, bring you back up. Your call light's right here if you need anything. Alright, so let me just wash my hands and leave the patient to go document the date and time of the procedure, the size of the Foley catheter, the patient's tolerance, as well as the description of the urine and the amount of the urine. Knock, knock, knock. Hi, my name is Britta. I'm a student nurse, and I'm here to take out the Foley catheter that you've had in for a few days. Can you please verify the name and date of on your date of birth on your wristband is correct? All right, perfect. Do you have any allergies that I should be aware of? No. And do you have any pain right now? No. All right. I'm also going to do a general assessment of the patient. He looks fine. I'm going to keep going. So what's going to happen is really simple. We're just going to attach this syringe to deflate the balloon that's holding it in the bladder, and then gently pull it out, and that's the end of the procedure. Do you have any questions or concerns? All right, great. So let me just make sure I have everything. All I need is a chuck, a syringe still in the package, and some clean gloves. All right, so I'm going to go ahead and close the door and provide the patient privacy. Position the patient. We're going to do it the same way that we did to insert it. All right, is that comfortable for you, Mr. Elephant? Yes? All right, great. I'm going to lay you down as well. Okay. Next, I'm going to wash my hands, put on clean gloves, open the syringe packet, and then I'm going to attach it to the balloon catheter port. Take out between 9 and 9.5 mLs. All right, take that off. All right, Mr. Elephant, we're going to take it out now. Go ahead and take a deep breath in and exhale. You're doing good. Now, if I felt resistance, I would try to extract more water from the port, from the balloon. If that still didn't work, I would need to stop and contact the provider. Everything's coming out fine though, so I'm just going to keep going. Wrap this up and take this to the restroom to document the urine amount and the color, and then I would discard the urine and put everything in the trash like this. I'm going to come back to the patient, take off my gloves, wash my hands, and then start repositioning the patient. All right, Mr. Elephant, you did a great job. Do you have any questions or concerns? No? Okay. Do you have any pain right now? No? Okay. And was that tolerable? Yes, it was. Great. So there's a few things you need to know. The first few times you urinate on your own, it may burn or sting. That's normal. It will go away. Also, you need to let us know when you do use the restroom because we are still monitoring your eyes and nose. So use your call bell to let us know before you flush the toilet or anything like that. And I'm going to come in and monitor that. And also you need to let us know if you're not being able to urinate, if there's increasing pain while you urinate, or if there's blood in your urine, okay? Yeah, any last questions? Okay, so here's the call light. I'm going to wash my hands and leave the patient to document the time and date of the procedure, the patient's tolerance, and the amount and color of urine from the Foley bag and the next 2 voids.